Hi, good morning, good afternoon, good evening, wherever you're watching me from. Welcome to my channel. Thank you for tuning in. Thank you for subscribing. Thank you for liking. Thank you for sharing. I'm so blessed to have you guys on my channel. Thank you so much. This means a whole lot. I want the world to get to know the little that I have learned on this journey as a childcare provider, because for me this is not just a job. This is more like a passion. This is more like a calling, right? It gives me joy to take care of children. So today I will be giving you guys a tip about baby feeding, right? I will be talking about bottle feeding, like formula or milk, breast milk that is put in a bottle for children, babies, right? So there are some babies that after taking breast milk or formula, you find out that they'll be crying so much their tummy will hurt. Sometimes if you touch their tummy, it will be a bit hard, and they'll find it difficult to even go to the toilet. They'll just be crying. Some of them, they will develop colic after they've given birth to them, and some, it could be gas. They have too much gas in their system. So what I'm going to show you guys is a straw and a bottle, and a feeding bottle. So if you buy mostly Dr. Brown's, I know some Dr. Brown's bottles or feeding bottles don't come with these straws, but if you're opportuned to buy a Dr. Brown's bottle, make sure you buy this one that comes with a straw. Can you see? Can you see the straw? Yeah, this is a straw. Some people might not even know what it's used for. This is a straw. It comes with the bottle. I mean, when you buy the bottle, the straw comes in with it, right? So after you put your water and your formula, you shake it a little bit, shake it nicely. You put a straw over it, and this is assembled already, right? So you cover it, right, and you give it to your baby. Okay, and then you feed your baby. Okay, see, can you see? So this basically is going to prevent split up and also it will reduce colic, right? It will reduce colic and gas. Okay, so when they're taking the milk from this, it's going to reduce the gas from going into their mouth, because once they're not sucking from the breast directly, as they're sucking from the air will be entering into their mouth. And please, when you are giving your baby this a bottle, when you're feeding them through the bottle, make sure once the milk is finished, don't allow them to keep sucking. All right, they'll be sucking in air, and that is when the air will be accumulated in their tummy, and then they'll have so much gas in their tummy. Okay, so if you use this, it's going to reduce the gas, it's going to reduce the colic for babies that are suffering from colic. This is very, very good for them. They call them anti-colic bottles, right? So this is very, very good for them. I would advise parents, if you have the opportunity to buy Dr. Brown's feeding bottles, I don't know about other products, but I know of this one, right? And it comes with this straw in it. So if you can, get this straw, and that will help you a lot. And also this will help burping as well. I don't know how, but I've realized, because I've given babies milk without the straws, and I've given them milk with this straw, and I can confidently tell you that when a baby drinks a milk with a feeding bottle with a straw, it helps them to burp as well. Like some of them even burp by themselves, right? The gas is not too much. The straw somehow it helps it helps them, reduces the amount of air that's going to get into their mouth and into their system, which it will help. And also try as much as possible to burp to your babies. Make sure they burp after each feeding, please. Excuse my pronunciation, okay? I hope you understand what I'm saying, right? So you burp, then you know how you do. You do your hand this way. Can you see? And then make sure it's folded, and then on their back, right? So you just hit it a little bit. Don't hit it hard. Don't slap them, not this way. Can you see? And then on their back this way. Or if you don't want to do that, you can rub their back, or you put, especially the ones that suffer from colic, that have pain, find it difficult to go to the toilet, or too much gas in their tummy. You can put them on your legs, and then you can rub them, or you can put them on the flat surface, and then do bicycle ride, right? You do this way, bicycle ride. You take their leg, you hold both of their legs, and you do bicycle ride, right? And then, or you can take it forward, bring it back, and press with your legs. I'm sorry, I'm not using the baby to demonstrate this, but as a child care provider, I need to protect my children, right? I can't bring them on social media. It is not right. I need to protect, the safety of the child, right? So I don't know, it's individual. I know some parents don't mind, but I do mind. I don't think children should be on the social media until at a certain age, of course. So that is it. And make sure these bottles are washed very, very well. Please make sure you wash them very well. They're actually brush. They're actually little brushes that you can actually use. You open it, dismantle them, put the brush in, wash it really, really well, rinse thoroughly, rinse it with clean water, like wash it thoroughly. After washing them, you rinse really, really, you can wash them like 3 times, right? Because you can, especially these straws, if you don't wash it very well, bacteria are going to get in, so you have to wash them really, really well. After washing them, you sterilize them, okay? If you don't have a sterilizer, you can boil them in water, and some people add sea salt in water and then put the bottles and boil them, in water for some minutes before they bring it out. But if you have a sterilizer, after washing them really well, you will dismantle them, of course, before washing. So after that, you put them in your sterilizer and put it in a microwave for the amount of time for the type of sterilizer that you're using. So after that, you allow it to cool down, and then you dry it, and then put it nicely in a place that dirt won't get in. Okay, we have to be really, really careful, because you find out that children are sick, they take them to the hospital at a very tender age. You'll be hearing like a child has bacteria, has this one, has that one. So the bottles needs to be handled really, really well. Okay, don't take chances. All right, make sure they're washed very well and sterilized well and kept appropriately, so that they won't get bacteria in, and that won't get into the baby's system and all that. So this is what I wanted to talk to you guys about. And please, I'm not a doctor, I'm just a childcare provider. I am sharing these tips from my experience. Okay, thank you for watching. Please subscribe. Thank you.